Hello and welcome. You're watching yet another edition of Coronavirus Facts versus Myths. It is for the second straight day that India is reporting over 2 lakh cases of COVID-19, sixth straight day of over 1.5 lakh daily cases. The rate of increase in the new cases is significantly higher in the second wave of COVID. Health Ministry sources tell NDTV that there are variant strains being reported in India. Look at the number of active cases we have currently. Over 15,69,000 active cases of COVID in India. India's R factor, which is the reproductive rate at which the virus transmits from one individual to another, is the highest in 1 year at 1.37. The infection this time around is spreading far more rapidly. There are clusters emerging within families, households, and even neighborhoods. Reinfection is possible with a new variant of COVID. So just because you've had coronavirus in the past, it doesn't mean that you can't get a reinfection. That's the worrying story. Now, amid this second wave of COVID, there are many doctors and experts who are now increasingly talking about a new cause of concern, which is lung infection. We'll ask our panel of doctors more about it, but what they're observing essentially is a rapid progression of lung infection that is being seen in people. There are faster pulmonary changes, and is this really linked to the new strain? So we'll talk a little bit about lung infection. But before we open this up to our panel of experts, I also want to address news that is just coming in. The Lancet Commission India Task Force has made some recommendations in the light of the new coronavirus wave that India is seeing, this second wave of infections. They're talking about a faster pace of vaccination. They're talking about documenting adverse reactions to vaccination. Interestingly, they're also talking about a massive curb on public gatherings for the next 2 months. The Lancet Commission recommends that no more than 10 people should be allowed to gather in one place for the next 2 months in India. This is an extremely important recommendation coming at a time when we're seeing the Mahakumbh, we're seeing political rallies, we're seeing weddings still being permitted in large numbers across the country. We'll talk a little more about this, but let's focus on the second wave and what are some of the worrying characteristics of the virus as it is transmitting today. Joining us on the broadcast, we have Dr. Sudhir Mehta. He's the lead and coordinator of the Pune platform for COVID-19 response. Thank you for being with us. We have Dr. Neeraj Jain, Chairman, Department of Chest Medicine from the Gangaram Hospital, and Dr. Veer Pushpak Gupta, National Health Service UK, joining us from London. Thank you, doctors, for sparing your valuable time. Dr. Gupta, I want to begin by asking you, the UK variant is predominantly being seen here in India as well. Did you see pulmonary changes, lungs being severely affected in patients in the UK?
Well, thank you for having me on the show again, Rishika. Yes, we did. I mean, we saw a higher infectability of this variant, the B117. We saw younger people being infected. We saw more admissions to ICU, particularly of younger people. And the changes that you're talking about in the lungs is what the virus does generally, because the virus causes an intense immune reaction, which causes an autoimmune cytokine storm, as we call it, which destroys lung tissue in the process. So, yes, the answer is that we did see lung changes. We saw higher infectability and more ICU admissions, and that's exactly what's happening in India at the moment.
Dr. Jain, you're a specialist in this field. What are you witnessing? Because many experts are saying that lung infection is being seen in those patients without comorbidities as well.
Yes, I think I would agree with that, because last year when we saw the COVID cases, there were severe pneumonias which we thought would slowly progress to a lot of interstitial fibrosis. But, you know, the number of cases who were devastated in a matter of days or weeks were lesser. This year, we are definitely seeing more cases. And the worrying thing, I don't know whether the others have the same experience, what we've seen here is that the disease tends to suddenly become more severe after first 4 or 5 initial days of relatively mild disease. Then it suddenly becomes more severe, and in the second week, up to 2 to 3 weeks, the disease suddenly takes up, and you know, the fever and the lung involvement becomes very severe, and it doesn't respond to a lot of the treatment that we've been using. And what makes it more dangerous is highly infectious strain that we are seeing, it is transmitted so easily that the number of people, it's not surprising that the number of people that we are seeing has gone up in the way it has.
Dr. Mehta, would you tend to agree? You're joining us from Pune, which is seeing an unprecedented surge in COVID-19 cases. We know that this is a faster spreading strain. But are you also seeing a severity of lung infections in several younger patients? What's your assessment?
Good afternoon. I represent the Pune platform for COVID response, which is basically working with about 250 of the government and private hospitals in the city. And a lot of the analysis that is being done by the group is actually showing a combination of different things. First and foremost, it's not just the old people who are getting infected and are dying. We are seeing a lot more of the younger population, which is now getting infected and unfortunately is having fatalities. That's number one. The second point is also happening is the deterioration seems to be much faster in the number of cases. So the deaths after admission seem to be much faster than the first wave. The third and most important fact is that the virulence of this seems to be much, much more. So while Pune had an earlier peak, this time the peak has been much, much more. And the prevalence in rural areas also has been much more, and more members of a particular family do tend to get infected. These are some of the factors that we are seeing in the statistics that we are looking at.
Right. Dr. Gupta, very briefly, I want to ask you solutions. When we're talking about this rapidly spreading variant, you've just been through it. The UK, if we can put out that graphic, one can actually see that there's been a steep decline in the number of daily cases after going through, perhaps one of the worst phases. What would you quickly recommend? What are the fixes?
I've been saying this time and time again. I was very sad to see a few months ago when weddings were happening, social events, gatherings were happening, people were let to do whatever they want. You can't do this with this virus. This virus mutates very, very fast, and it can affect populations that were never affected before. So, the three things that we did here was effective vaccination. Vaccinate as many people as you can, at least with one dose. Even one dose protects you with 70% immunity. Vaccination should be the number one priority for the government. Effective lockdown measures, social distancing measures, hand hygiene, these things need to be repeated time and time again. We cannot put the foot off the gas. That is the most important thing. And if we get complacent, then we will see what is happening in India. And we need to get back on it where we were last year and get focused on doing these things all over again. Otherwise, this is going to rampage through like it did in the UK. Now, if you look at the UK's numbers, we're down to about 500 cases a day from 50,000. So clearly these measures work.
Yes.
Other countries have tried it. So I think that the government needs to be very focused on these measures now and take it very, very seriously before disaster takes over.
Well, I think your perspective is very important. You having the benefit of hindsight, I think there's a lot that India can actually learn from what the UK did right in terms of both vaccinations as well as effective containment measures in terms of, micro containment or mini lockdowns, some of which is already being implemented here in India. We have our first caller, Sanju, dialing in from Mumbai. Go ahead.
Hi.
Hi, go ahead.
My question would be in two parts. First is that my mother has got her first vaccination dose, which is Covishield, and she's going to take her second vaccination dose in a gap of 7 weeks. That is, she's scheduled on the 26th. So I'm following the protocol which has been advised, like to take the second dose between 6 to 8 weeks. So my question was that once she finishes this vaccination dose and when Sputnik comes into the market, can a person who has already been vaccinated by a vaccine which is 70%, having 70% efficacy, can then take a Sputnik vaccine which will have 90% efficacy?
All right. Dr. Gupta, would you like to take that on?
So I just want to reiterate her question. So she's saying, can you take another vaccine after you've taken the second dose of the first vaccine?
Yes.
Yeah, I don't think that is advised. I think if you've taken a particular vaccine, in your case you took Covaxin, you should stick to that for the second dose. And after that, you do not need another vaccine. That is your protection. That is your immunity. So, percentages don't matter much in these cases. The fact that you have antibodies is the most important thing, and you will be able to fight off the infection effectively with those antibodies.
So, your mother has taken Covishield. She must take the second dose of Covishield, and there's no need to take another vaccine that may have a higher statistic at a later date. That's an important clarification. Arpan Bose is dialing in from West Bengal. Go ahead.
Good afternoon, Rishika ma'am and other respected doctors. I am Arpan Bose. I have two questions for all of you and for the world also. First of all, I want to ask that arsenic album 30, a homeopathic medicine, which had played a major role during the COVID pandemic. So we can take it after taking vaccine. And secondly, I want to ask those who have stones in kidney, they what COVID can do with them.
Dr. Jain. Okay. Thank you for your question, Mr. Bose. Dr. Jain, homeopathic medicines, can they be taken or on a continued basis after vaccination?
So I think the principle of treating any disease with any drug, whatever system of medicine it belongs to, has to be vetted and approved by the drug controller for use in that particular system. Now, it's not just modern medicine. All systems of medicine have to go through that. We can stake claims to anything. I must admit, I am not knowledgeable enough. I have not seen any data on this. So I would not recommend anything that I don't know about.
Right. Dr. Gupta, would you like to comment on how a patient with kidney stones could react if they contracted COVID?
Patients, when they have comorbidities, when they have other diseases, will obviously be more susceptible to a greater infection with COVID. There's no particular indication that kidney stones would cause a greater infection with COVID, and I think that they should just follow the same principles of treating themselves, self-isolating, taking care, and obviously maintaining their own symptoms and monitoring their own symptoms, and making sure that they're not in need of hospital care.
All right. We have Prema from Pune dialing in. Go ahead.
I'm calling from Pune. I have called quite a few private hospitals in Pune for taking Bharat Biotech's Covaxin first jab. But they are telling that they don't have it for first dose, they have only for second jab. But I want to know whether it is going to come in future or they are going to stop it, or year end when they are collaborating with Haskin, then only they are going to roll out.
Okay, we also have Shachi Joshi from Delhi. Let's take that question and then I'll have both answered.
Yeah, ma'am.
Go ahead,
Hello.
ask your question.
Yeah, my question is that my husband is 62 years of age. He's suffering, he's having diabetic and he's on insulin. He got corona during end November and his fever continued, very high fever, for about 14 days, ma'am. And twice RT-PCR test did not detect that he's having corona. But after he was okay, after a month or so, we felt that he's having corona because medication given was the same. So we went for antibody test, and antibody was so high, it was around 137.
Okay.
Now, my question is whether he needs to go for vaccination.
Right.
Number one. Number two, if at all he has to go, which vaccine he should be taking?
Okay. Important question. Let me first take Prema's question to Dr. Jain. Dr. Jain, the supply of Covaxin, if it's running short in certain hospitals, as this viewer is reporting, what should they do about the second dose? Should they wait?
I must admit, I am not aware of any such official information that we are going to run short on the Covaxin. As far as I have heard, that they are actually going to ramp up production and there will be enough second doses to go around.
Right.
And I do not think that the government will be so irresponsible that they will start the vaccine without having, the adequate numbers. So I haven't heard anything to that effect.
Okay, so you should perhaps cross-check that information as well. To our viewer, you must contact the nearest hospital and cross-check that information. Dr. Gupta, would you like to answer the question about the 52-year-old diabetes patient who has very high antibody count now? Which vaccine should he be getting, if at all he should be getting one?
Whichever vaccine is available in that area.
Okay. And he should get the vaccine still?
Yes, you should get the vaccine still. Antibodies, because of previous infection, do not ensure that antibodies will remain in the future. With the new variants coming in, with the different infectability of the variants, it's essential that you get protected with the vaccine. Whichever vaccine is available, please go and get it.
All right. So that's something that all experts have reiterated time and time again on the show. Thank you so much, doctors, for sparing your valuable time and answering our questions so very patiently. We're going to slip into a very short break at this moment, but coming up on the other side, we'll talk to a top expert from the United States on the issue of blood clots that's been found both in AstraZeneca as well as the Johnson & Johnson vaccine. Stay with us. Welcome back. The Johnson & Johnson vaccine in the United States has been paused temporarily over concerns over blood clots. Now, this is all too familiar for us here in India, given the fact that there are similar concerns that have been raised over the AstraZeneca vaccine as well. To answer more questions on this, Dr. Peter Chin Hong, infectious disease specialist, joins us from California and San Francisco. Thanks for being with us. You know, I want to begin by asking you, the Johnson & Johnson vaccine, about the Johnson & Johnson vaccine first. It's been paused over concerns of blood clots. What more can you tell us about this at the moment?
Well, first of all, it was very rare, as you mentioned, 1 in a million. So there were 6 cases. They were all women, ages 18 to 48. It was a very rare blood clot in the brain. It was called CSVT, so a thrombosis or clot in the brain. 1 woman has died, 1 is in critical condition, and the other 4 are doing well. So the CDC and FDA have paused it. They were caught between a rock and a hard place, so to speak.
Well, there's similar concerns over the AstraZeneca vaccine as well. Would you like to weigh in?
Yes, I think many people think that it's the same biology between the clots seen in the AstraZeneca vaccine and the J&J vaccine. Of course, it's a hypothesis with J&J, not as much information so far, but it all follows the same pattern. First of all, very rare blood clots occurring primarily in women who are younger and who don't have any obvious risk factors, although these women in the US are still being investigated. It's thought that it's due to some immune activation that affects platelets. And because the platelets are activated, they both result in low platelets and increased susceptibility to clotting in this rare circumstance.
Right. It's interesting because a lot of experts are now increasingly talking about whether this is a viral vector vaccine issue. Would you say that this is now an issue that's associated with viral vector vaccines, or would you not go so far at this point?
I think I wouldn't go so far. There's been theories proposed that maybe the virus vector itself brings in some unwanted fragments of genetic material that can additionally activate the immune system, but that's just speculation.
Right. Is this then a call, Dr. Peter Chin Hong, for countries across the world to, carefully study after effects of these vaccines? Do we need more data on adverse effects after immunization, the concept of AEFI?
Yes, there certainly needs to be surveillance. Surveillance does 2 important things. First of all, it, of course, gives us ideas about rare events that occur after vaccinations. But secondly, it gives a strong signal to the general public that, regulatory bodies, public health agencies are concerned about safety in a very authentic and genuine way.
All right. Thanks so much for joining us on the broadcast. And those are some important clarifications coming in at the moment on an issue that really everyone is very concerned about. That's all we have time for on the show today. We'll be back next week with brand new episodes. Till then, stay safe.